Hey everybody, welcome to the 5th Annual Parent Network Conference. We are excited today to have you join us for creating a collaborative culture using policy to reduce restraint and seclusion in the schools. Before we get started, we have a few housekeeping items. First, if you have questions during the session, please use the Q&A feature that is part of the Zoom menu on your screen. It's easier for us to manage them that way. We do have a poll that is going to pop up at the beginning just to kind of see who we're talking to. It is anonymous, so go ahead and feel free to join that poll. After the session, you are going to see a survey that pops up to ask you how we did. It'll help us design workshops for next year and help us give a little feedback to our speakers. So please share if you can. Also, if you are an Idaho parent, the Idaho Parent Network survey for this year just went live this week, and we would really love to hear from you and your thoughts on the system. This year, we're actually asking some questions about our workshops, and one of those questions actually directly relates to this session and can give some feedback to changes that are coming in Idaho. You can find that survey both in the email you should receive tomorrow and also on our website, idahoparentnetwork.org. Now, in the coming days, we will be posting a recording of this video along with our slides and some resources for you to use. So check back to idahoparentnetwork.org to go ahead and to see that. So with that on the way, we're going to go ahead and get started. We wanted you to first be introduced to our participants. We have Dr. Charlie Silva, who is the Special Ed Director of Education in the Idaho State Department of Ed. We have Holly Gilio, is a parent. She is the co-founder of Special Education's Parents Alliance. We have Courtney Holtis, who is our advocacy director at Disability Rights Idaho. Renee Miner, who is with SESTA, the Special Education Support and Technical Assistance Associate. And we have Joe Gonzalez, a parent education coordinator with IPOL. And then Teresa Varela, I'm sorry, I just chewed your name up, who's an advocate supervisor with Disability Rights Idaho as well. So we are excited to have everyone here, and we're going to go ahead and let you guys have it. Joe?
I'm muted. Sorry, I was muted. So here are the objectives at a glance. What we're going to talk about is just helping families and educators understand, that policies that are created around restraint and seclusion, they don't necessarily encourage it, right? It's just there to provide boundaries on when to use it and if it's necessary to use it. And then talking about a collaborative effort to create such policies and procedures around that. Also learning about current trainings that are available for teachers and professionals and to proactive ways to avoid that action of restraint and seclusion. If it can be avoided, then I think that so the outcome might be more favorable as well. So those are just some of the things that we're going to look about, and then also to kind of address different topic areas as well on the next slides of what that might look like in our state particularly. Okay, so the realities here in the state of Idaho. Corporal punishment is not forbidden in Idaho schools. I remember talking about this with some of my staff, some of the people that I work with, and talking about corporal punishment and what that looks like in school. And for me, when I was in middle school, I was still allowed to be swatted. And so that's obviously not something that I think is practiced anywhere in Idaho, but it's still, I can't even imagine what that would look like today if that were still to be allowed. And I don't know if it is allowed in anywhere, but I remember, being swatted in middle school. And then that there is no federal restraint and seclusion policies for schools. More specifically to Idaho statewide, there is no restraint policy for schools or school districts to follow. Federal law suggests that we do have, restraint, that there is no, it starts really young at preschool age. And I used to work for a Head Start program a few years back, and I remember what that would look like with young kiddos, 3, 4, and 5-year-olds. And not that the Head Start programs encouraged restraint or seclusion. From my observation, sometimes it was a lack of training on a teacher's part and on my part on what that looked like when things get really chaotic and we don't know how to handle that situation. It came sometimes, as I observed, as a instinct to just grab a child, hold them until they were able to calm down, not realizing that sometimes that created more stress and burden on that child. And so it was just a horrible loop of not having that proper training to be able to address those situations. And it was difficult. It was difficult to be able to go about day to day, especially with kiddos who had behaviors, right? Who had problems or issues with following directions or what that might look like. And so sometimes it was, it's time to eat, let's sit down, and, grabbing kiddos and just kind of manhandling them to sit down and eat their lunch, which would create a unfavorable response at times. And so not only was it hard to get them to sit down because they didn't want to, but then it became a distraction to all the students, the rest of the class, trying to move forward and go through that transition time, whether it was sitting down for circle time or sitting down to have lunch or breakfast or any sort of meal. It just became a distraction, not only for the teacher, myself, that student, or and all the other students. But as we were able to get some training, we were able to kind of mitigate some of those situations. And I can't remember who I was talking to this about. It might have been this group or not. I can't remember. But talking about restraint, what it looks like with younger kids versus what it looks like with older kids. And I do, as I work for Idaho Parents Unlimited, I do get calls from parents who are looking for resources about kiddos who are bigger, older, stronger. I think that sometimes as kids are younger, they're more easily manipulated, I guess, to do what you want them to do. But as they get bigger and stronger, what does that look like? And as you see on the slide, law enforcement gets involved, and too often, especially with the kids that are stronger, whether it's at home or at school. What do you do, right? What do you do when you can't control a student or a child and they're too strong? I guess the thing that comes to mind is to call law enforcement. But what does that look like when you call the police on a child? The police come, they have a bad experience with law enforcement, and also happening with restraint, seclusion. They might be placed in the police car until their parents can come, but they're secluded, they've been restrained, and sometimes not understanding why. So and what does that look like, not just in the school setting, but in the law enforcement side? What can we do as a community? What does that look like to help law enforcement with training for them on how they can handle those types of calls? What does that look like for them? Um, but then we go back to the question of, sometimes why are we calling law enforcement, and how can we get those proper trainings to be able to mitigate those situations and not have to call law enforcement. Um, but as of right now, it's, I do have parents who call and that's the answer. That's the solution, is to just call the cops. Some kids acting bad, call the cops if you can't um, control or gain control of the situation, especially if they are bigger. And it's not just an issue for special education. Um, it's obviously for all children, right? Any child that has to go through those things. However, oh,
Did we lose Joe?
I think it's your turn,
Oh,
Charlie.
sorry. Sorry, Joe.
No, that's okay.
It's like, wait. Sorry about that, Laura. First of all, before I begin with the lessons learned, I want to start by thanking the Idaho Parent Network for bringing us all together to have this discussion about a very, very sensitive topic of restraint and seclusion. So thank you, Idaho Parent Network. I am pleased and honored to be able to present not only with my colleagues at DRI, but also iPool, and super excited to have a parent part of the panel as well. So thanks, Holly. And then Renee, who, as Laura mentioned, works for SESTA, which is Resources and Training Center that is actually funded from the State Department of Education. So just a shout out and a thank you, a sincere thank you. I want to just remind us all that we have the same goal, right? And I think that goal is that we want to keep students safe, and we want to create an environment that promotes learning, promotes social and emotional well-being. So the fact that we're all here together modeling, right? I like to see this as a great example of how agencies can come together and they can focus on an issue that impacts all of us. And I feel very fortunate in the state of Idaho that we do this, we continue to do more and more of this, okay? And I apologize for the siren in the background. Okay, so let's begin with the history lesson. I get the exciting stuff, right? Well, many of you know that this goes back to 2009. And actually, if you did more exhaustive research, it goes well beyond 2009. It just came to the forefront by the Secretary of Education in 2009 and really pushed, as well as Congress, pushed for states to start having conversations and to develop guidelines, policy, procedures, etc., around the issue of restraint and seclusion. In our state, in 2009, the State Department, along with the State Board of Education, did bring a group of stakeholders together. At that time, I actually was the special ed director for the Boise School District and had the opportunity to participate in that work, as well as did DRI. And at that time, it was Dina who sat in on all those work groups. And I remember vividly on some of those meetings, and you know, they had all the right people at the table. They had parents, they had school district, they had agencies, and we worked for, I don't know, it seemed like, you know, an entire year on proposing regulations, guidance, etc. And then all of a sudden, and I'm not exaggerating, it went poof. It was like, did I miss a meeting invite? What happened? Well, what happened was at the federal level, they put the brakes on. Why they put the brakes on, I can't remember. Something else caught their attention, you know, but they put the brakes on. So as a result, my recollection really is it just kind of went away at the state level. Now, that does not mean that many districts didn't take it upon themselves to create their own policies. They did, not all, very few, but some did. So fast forward to May 2012, and I believe it was Secretary Duncan at the time, and he published the resource. You can find it, I think Courtney was kind enough to put it in the chat. It's also on our website in various places. But fast forward, that came out. That's an excellent resource. I thought it was very well done. It's comprehensive. The problem is, in reality, too many times it sits on a shelf, right? It just sits on a shelf, and we don't do much with it. So continuing on, Vanna, will you switch the slide? Thank you. So fast forward, December, and you can see it on the slide, there continues to be work that was done. But each state approached it differently. And I was fortunate enough, I think it's been about 2.5 weeks ago, we had the National Association for State Directors in Special Education conference. And there was a session on restraint and seclusion. It was very well done. And it was a panel, and it had Washington, Kansas, North Carolina, Florida, and one other state. They chose these states, Nebraska. They chose these states because some of these states were far more progressive than Idaho going back to that 2009. And I'll use Kansas as an example. They began at full speed ahead in creating guidelines for restraint and seclusion dating back then. Also, North Carolina is a state that also had corporal punishment still on the books. And as a result of the work going back to 2009, they were successful in getting that repealed. So there was some really good work that was going on. What was interesting, and this is to a point that Joe made earlier, is that these states that really are considered kind of the leaders, if you will, in this work, especially Kansas, they have a very robust system. They made it very clear, and I want to make it clear today, this impacts all students. This is not just a special ed issue. And one takeaway I had that I'd like to share that Virginia did is their state created a 2-tiered system. And the tiers are, tier 1, it's for all students. We're gonna teach all statewide, all educators on de-escalation techniques for all students. Then they took it to the next level of the tier of dealing more with students with special needs who are either receiving services under IDA or 504. And I thought, wow, kudos to them. That's pretty exciting. So, again, while maybe Idaho at a state didn't have the momentum that some of these others did, I wanted to share that just because I do think there are some examples out there that moving forward, we may want to further investigate and see, what we can do in our state. Next slide. All right, so we all know we're in Idaho and it is very much a local control state. But even though, because sometimes people think, oh, well, that just means, we're the Wild West and we can just do whatever we want on a whim and there are no rules or guidance. That's not true. While we do empower communities to make decisions that meet the needs of their communities, and we do that largely in education through school boards, superintendents, etc. There are some rules that they have to follow. And I didn't have a chance to do a thorough search, but many districts do have something, some policy or procedure around restraint, seclusion. Not that I want to take away from Holly, it's not to the extent of what she's going to share by any stretch, and it may not always be explicit in a policy, it may be implicit. A district may have a policy that says, we're going to keep all students safe, and it's kind of that generic catch-all language, but most, if not all, have something at a minimum at that level addressing safety of all students. So I just want to make sure that that's clear. Also, there are requirements for reporting, right? We have to report on discipline. I'm not talking restraint, seclusion, but on discipline. Thank you for that, Holly. Or I'm sorry, Laura. We report to the feds, number of suspensions, you know, half day, full day, number of expulsions. Here's the problem, and I've lived this. That data requirement goes through what we call EDFACS, which is a reporting system that we have to use to the feds, right? And oftentimes that people think all of that comes through special education. It doesn't. It comes from typically your building principals who report that data. So there are some requirements that all 177 districts in Idaho have to follow. But here's the, in all transparency, I don't put a lot of weight into that data. It's not accurate. And I probably should not be saying that from the position that I'm in, but it's true. Because, and here's why. Every district gets to choose how they're going to report that data, or more importantly, who's going to report that data. So I know in some schools, it may be the admin assistant in the front office that's reporting that. Well, that person may or may not have received training. They may code it one thing when it was actually something totally different. So I really don't put a lot of weight into the data that we do collect. And interestingly enough, in the panel discussion that I referenced a moment ago, and I'll use Kansas as an example, they have over 15 plus years of what I would consider very robust training statewide. But the unfortunate and the sad part of it all is they are not seeing the results that they should. And I'm not 100% sure they can tease out if they really don't have the results, or they just don't have the accurate reporting to support all of that good work. I mean, that's a huge, huge challenge. So again, yes, we are very much local control, but there are guidelines in place. Before I think that's my last slide, before I turn it over to Courtney and Therese, I hope you all stick with us throughout this presentation. And here is why. I really think we should all be looking at this in ways that we can improve being proactive and preventative, so we're not focusing on when we get to the extreme. And I think hearing Holly and especially Renee learning about all of the wonderful resources, while it may not all be in policy or procedures, we really do have some great resources. So stick with us. And at this point, I'll turn it over to you, Courtney. Thanks.
Thank you. So I'm going to talk about definitions. You know, we're using the terms restraint and seclusion, but what exactly does that mean? Because as Joe stated at the beginning of our presentation, there is no federal definition, no set federal definition of what those terms mean, because there's no federal regulations or laws around these terms. So in going back to that 2012 report that Charlie had referenced in her talk and that we have a link to in the chat, there were several studies done regarding restraint and seclusion, and lots of reports put together, and all this data was reviewed. And at the end, they had to come up with a definition for these terms so they could explain, you know, what isn't restraint or seclusion. And so they came up with some definitions of physical restraint, mechanical restraint, and seclusion. The definition for physical restraint is a personal restriction that immobilizes or reduces the ability of a student to move his arm or his or her arm, torso, legs, or head freely. But it does not include a physical escort. That means a temporary touching or holding of hand, wrist, arm, shoulder to induce a student who is acting out to walk to a safe location. Then they define mechanical restraint as the use of any device or equipment to restrict a student's freedom of movement. That does not include devices that are implemented by a trained school personnel or utilized by a student that have been prescribed to them by a doctor, or related services professionals use with them. And then there's seclusion, which is defined as the involuntary confinement of a student alone in a room or an area from which the student is physically prevented from leaving. But it does not include a timeout, which is a behavior management technique that's part of an approved program and involves monitored separation of the student in a non-locked setting and is implemented for the purpose of calming. So they found, those who were reviewing all this data had actually found examples of each of these definitions in the data that they were reviewing. This is what is happening across the nation. And I will note that when it comes to mechanical restraints, the report specifically says that they should never be used in school, never. If you want to learn more about these definitions, I would go to page 7 of that report, or I think it's page 7 of the PDF version of the report. It talks about these definitions and it talks about the exceptions. And at the beginning of the report, Secretary Duncan does this really great introduction where he says, restraint and seclusion should not be used as routine school safety measures, which means they should not be implemented except in situations where a child's behavior poses an imminent danger of physical harm to self or others, and it should not be used as a routine strategy implemented to address instructional problems or inappropriate behavior, such as disrespect, noncompliance, insubordination. And it should not be used as a means of coercion, retaliation, or convenience on the part of the school staff. And he goes on to say in that introduction that, really, restraint and seclusion should never be used, except in these extreme circumstances of imminent danger. And he also talks about the fact that, there's been lots of studies done on restraint and seclusion and its use, and there's no evidence that restraint and seclusion is effective in reducing problem behaviors in school settings. It's also interesting to point out that with these restrictions or with these regulations or lack thereof in the school setting, Congress was looking at the mental health facility world and noticing that there had been a big push in mental health facilities to put parameters around the use of restraint and seclusion, if not to totally eliminate the use thereof. So it's interesting that our mental health care facilities have progressed to the point where there are strict restrictions on its use. And in some cases, they don't use it at all. But here in the school setting, there were no restrictions whatsoever, no regulations. So what happens next in Idaho? As we talked about before, in 2008 and 2009, Congress had been pushing for federal legislation on this topic. That's what brought about this report that we keep referencing. Many states started to come together and develop their own statutes or regulations, including Idaho, like Charlie talked about. But unfortunately, when the feds stopped working on it, we did too. The topic of federal legislation on restraint and seclusion has been brought up and kind of reinvigorated lately. In 2015 and in 2019, just last year, there were some attempts at the federal level to address this, but they just didn't go anywhere, unfortunately. So I will let Therese talk about what DRI wants to do as far as moving forward on this topic.
Moving forward for Idaho and for Disability Rights Idaho, first we have to say that Disability Rights Idaho believes that there should be no restraint or seclusions at all in the schools. So we have decided as an agency to take this on as a priority for the next couple of years. So we will be looking at bringing stakeholders together to address restraint and seclusions in the school setting legislatively. So that will be our focus for the next several years, is actually bringing it forward and making sure that there are legislations in place that will protect our students while they're in school.
May I ask a question and then just a comment? So I really appreciate that DRI is going to be taking this on, and any way we can all, of course, partner, the better. The power is in the number of voices, right? My question is DRI given any thought, and I don't mean to put you on the spot, so just say we're thinking about it, about repealing the corporal punishment that is already on the books, or just taking a different approach? And I don't know, Courtney, you can just say we're thinking about it. I'm just curious.
I think we're thinking about it is probably
Yeah, okay.
the best answer we can provide.
Yeah, sure. And then the last thing I just want to say, what's next in Idaho from the State Department of Education's perspective? Two things. As I mentioned, I participated in the national conference a couple weeks ago, and the director for the Office of Special Education Programs, OSEP, out of the U.S. Department of Education, gave a keynote presentation, and in her closing remarks, she made comment, and I pulled them up, I was going to read them verbatim, but she made comment that we should be anticipating some more guidance on restraint and seclusion in the near future. Now, the near future for the U.S. Department of Education and the near future for us, our definitions may vary quite a bit, but we should be receiving something. What that will look like, I don't know, especially given, we're in an election year and all that. But the fact that she mentioned it, though, that tells me that it's on their radar. That tells me that they're working on it behind the scenes. So that I think is very, very promising. The other piece that's what's next in Idaho is we're going to continue to build all of our resources that we have through SESTA. We already have in the last, since I've been in my position now 6 years, we have increased pretty much every year, Renee, but we have increased our focus, our commitment, and our resources to behavior. And that has been in an increase in funding, an increase in people, experts, etc. So that's what's next for us. And I think, Renee, your turn.
That takes to me. Thank you. I really appreciate being a part of this discussion and this partnership as we talk about restraint and seclusion. This is a very important topic to me, and it's been the drive of most of my professional life. This particular slide just reminds us that if we're in a position where restraint or seclusion may be something that we're facing with in order to keep a student safe, that we also need to be thinking about how did we get here and how do we not do this again. One thing about making mistakes is what we get to re-examine our plans, and we get to re-examine what didn't work and fix it. And that's really the focus. How do we set up those teaching opportunities and support appropriate behavior before something challenging happens that doesn't keep that student safe or others around him. We also want to keep a focus on those positive strategies. And so in the olden days, there was spraying people in the face, and there was restraint, and there was corporal punishment, and all these difficult things where they had no teachers, and like Joe had mentioned, teachers didn't know and didn't understand that there are ways for us to support even the most difficult or complex learners in being able to have a positive experience at school and to learn the skill components that allow them to make different choices. It goes back to really focusing on autonomy of the individual. So just quickly, how do we get here and who has the most impact? We have a lot of guidance, and we've talked a lot about it at the federal and state level. Information comes down. The district then responds to that information and makes policies and procedures around to ensure that they're meeting the guidance and the information they're getting from the federal and state level. Then it comes down to a building, and a building principal and that leadership at the building level have to make some decisions about how they're going to make decisions around discipline. And then the classroom then has the onus to say, okay, how do we then implement these practices and guidance and policies from our building? And then it comes down to individual IEP plans. And one other component I want to mention here is the teacher. And Joe mentioned this a couple of times as well, is that teacher is really our touch point that makes a difference in what happens to our kids in school. We can bring down really good policies and practices, but we have to support the teachers and the parents in making decisions about how that actually works for those individual students. So that's really, really important. All right.
So I'm Holly Gilio, and I currently have a 21-year-old son who has multiple disabilities and would be one of those difficult and challenging students. We are no longer in school, so I'll disclaimer that right now. However, us personally have had some instances that led me here, of course. So what we're going to talk about is kind of how our situation led to our district working in collaboration to create our restraint and seclusion policy. And so this is from my perspective. So I'm not speaking for the school, although I will brag about my school district and all of that. It is from my perspective of kind of the process and how things happened. So there's unfortunately, most parents don't go out looking because you don't think that your child is going to have an issue at school. We don't even realize that that's even a possibility. So initially, it really is about parents, us identifying what all the problems are within a school setting. Mine was my child coming home with marks on him. So clearly that was my flag. And that's usually, as a parent, the first thing you're ever going to find out is, oh my gosh, somebody saw my child get restrained, or they come home hurt, or somebody tells you that they've been putting them in a timeout room or a seclusion room. One of the other problems that parents face is we don't know. As Charlie said, there's not a lot of reporting for this, so we're going to talk about that a little. If you aren't responsible for reporting to people within your school district, then clearly your school district is not going to report to the state, and the state's not going to report to the feds. So we have no idea how much of this is happening until it happens to you, and then you're on this mission. So not being told, in my case, the first time, not told, not told that any of it was happening, which led to us believing, well, there's got to be a process, right? If this happens, what happens next? Well, there was no process. So limited documentation, there's no process in place in many schools. So if you're not documenting what happened, and you're not reviewing what happened or what led up to the events that happened, how are you ever going to review and look at making it better? Our schools tell us all the time when we're in our IEP meetings, our 504 meetings, it's all about the data. Well, if you don't have data in your school to tell you how often this is happening, is it happening? So we're going to talk about that. For me, initially, it was thinking that there was a guideline, thinking that there has to be some kind of, there has to be a protocol that happens if a kid gets hurt at school, for behaviors or whatever, what happens? Well, as we found out at the time, there was no protocol, there was no process. And so that led me to research. That's where I learned, what was allowed. That's when I learned that, hey, corporal punishment is still allowed in our schools. Hey, there's no policy for restraint and seclusion on a state level, and even worse, not on a federal level either. So where does that leave you, right? If you have to, as a parent, you have to start looking, and even as a school district, you have to start looking, like what's out there for you. Gather your information, figure out what your issues are, and then we went so far as searching our school districts and some of the school districts around us, to learn that very, very few had policies in place at the time. That's not to say right now they don't, because I do believe that there's a lot more that do. But at the time, there weren't a lot. And I seriously picked up the phone and called, like, I don't even know how many school districts, and said, hey, I just, I'm doing research and I'm trying to find out if your school has a restraint and seclusion policy. And we've said all this time, even in here, that, this isn't just a special ed issue, but the reality is our children of color, all of those things, they are the ones that are getting restrained more than anybody, significantly more. And every time I called a school and said, do you have a restraint and seclusion policy? Their comment was, let me connect you to special education. So, we do have to let everybody know that a restraint and seclusion policy in your school district is not for special ed. It is for everyone. All the rules apply for everyone. If you can't restrain my typical child, you can't restrain my special ed child. And so that was something that was really hard for me as a parent to understand. Like, why was it even allowed? So looking at where we moved forward, like, we looked at other districts that had policies, which was great because the ones that had them at least had something in place. And then our district, luckily enough for us, we had somebody who actually, eventually we had somebody who took the job and kind of started reviewing things in a different way. And he pulled together our stakeholders. He pulled together our parents, our teachers, principals, everybody. And we really openly discussed what the problems were. Part of that was probably as a special ed district, I would say that it would be hard to sit there and listen to parent stories over and over again of what happened, because it's traumatic for everybody, right? But within the stories themselves, you see where the gaps in the processes are. So if you don't know what happened with this particular case, you might miss an important step, which is kind of what we found. So our school district really looked at all the information that was available. They took all of the policies that they could find and the suggestions that they found, and they came up with their policy. Then they brought in parents. Notice they didn't do teachers and admin first. They brought in parents. So we started having these little powwows, and then teachers came, and then they went to, once they had buy-in from the parent and the teachers and the principals, we came back, all of the parents, we all agreed. We were good with the policy. Then they went to the school board, and our school board didn't even really ask any questions. Seriously, they just said yes. It was kind of, well, of course we would do this. Why wouldn't we do this? It keeps all kids safe, right? We have great processes. We have everything in there that anybody could need. So some of the stuff that we did in it was, not only is the policy in our district tells you what restraint and seclusion is. One of our questions was about imminent danger being kind of subjective. Our policy actually tells you what imminent danger means in the eyes of the school district. You know, if they will be hurt within a minute, you know, if you don't do something, then it gave you, it kind of took away the judgment of a particular person. Our policy also doesn't mean, if a child is breaking a computer, doesn't mean you get to restrain them. Product or supplies, it's not as important as the child's body. So there was a lot of things in there that were added. Our schools really, I think part of the buy-in from the school district and the teachers and everybody was that it wasn't designed for teachers to get punished. It was giving them options of what they should do. And then if something happens, what do you do at that point? So the procedures that went along with our policy were great because it says within 24 hours, parent has to be notified. Immediately, your principal has to be notified. Your school district superintendent, your special ed director, all of those people have to be notified, which eliminates somebody not reporting or hiding, or that didn't really happen. And so everybody within 24 hours knows what happened. It also allows for reflection. So part of the policy is, and the procedures are, if you get to a point where you have to restrain a child, everybody who was involved or present has to come back to the table. They have to discuss what happened, how people handled it, and decide how they're going to move forward the next time this behavior or this issue happens, so that they don't end up with the same issue. So that it wouldn't, you know, we wouldn't have a restraint. So from the parent side, when you have good policy and you have procedures, we know what to expect. Our children know what to expect. Our students know what to expect, right? Our teachers have guidelines. They all know what to expect. They know what the ramifications are going to be if something happens, how they have to report it. It's a lot of paperwork. Just that in itself probably helps with not restraining quite as often. But fewer injuries. We heard this over and over again when we were looking at stuff. Teachers and admins really believe that if they're not allowed to restrain, they're going to have more injuries. And the data doesn't support that at all. And with fewer restraints, there are actually fewer injuries. And I think part of that is also, if you're not restraining, you also are really getting better training usually on how to de-escalate stuff. On the admin side, some of the things that we've heard is that having those clear guidelines for their staff, for their teachers and their staff, creates an easier, I don't want to say easier. Okay, it allows for better training, right? If somebody needs more training. And it also allows for removal of a teacher or a staff if they're not willing and won't follow the policy. Whereas before it was like, so they didn't follow school rules, big deal. But now you have policy in place to back that up. And it really, really does help. So we're sharing, I'm in District 93, kudos to my peeps, because they really did make it really easy. They turned a really, really bad situation that unfortunately the people who fixed it were not part of the problem. They weren't there when it happened, but they took my story and they helped us create policies in our school district. They did the procedures and they let us parents be a part of the process. And just like we're doing here, we had everybody at the table. So once they were done and once they were sound, and clearly there's lawyers involved also, because come on, this is policy, and this is some serious stuff. And like for parents, I would tell them not to be afraid if your school district says, I got to have our lawyers look at this. It's just common practice. There's nothing to be scared of. It's to protect everybody. And that's the way these things should be looked at. These things should be looked at protecting not just our students for being safe. It should be protecting our teachers, our staff, everybody from having something happen. So we are giving you links to the District 93 restraint and seclusion policies. There's multiple policies, and then there are the reporting requirements for that tell pretty much what you have to do if it happens. So.
All right. Holly, I really appreciate that description of how to get to appropriate policies and procedures that help the teachers and give them resources as well. And that's kind of where I come in at SESTA too, is I work with board certified behavior analysts as part of our behavior team in the state, and we build resources that support us not just at how are we going to de-escalate, that's part of our focus, but how are we going to teach the child in way down the line before that so that they don't need to escalate or feel frustrated, and reduce anxiety and really focus on those skills that are at that antecedent level. So I want you to pay attention to a couple of websites, particularly as we go in. Most of the slides that I'm going to go quickly through are from the Idaho Training Clearinghouse. If you go to idahotc.com, most of the resources I'm going to go through quickly in the next couple of slides will be found on that website, and I just want to highlight a few. Go ahead, Laura. This first tool, if we're talking about prevention, I just want you to focus on, this is a tool that we work with teachers through, and it's basically, is the child's behavior interfering with their ability to learn, the ability of others to learn, or to build social competencies so that their life can be rich and have fine quality. But these three pieces in the middle are really key for our teachers to understand, that we want to create an environment that's predictable for our learners so they can anticipate good things that are going to happen there. They know what the expectations are. It helps reduce anxiety, and we've got some expansive trainings just on that square. Then we want to think about motivation. Are environments good places? Do the kids like being there? Are they able to access reinforcing relationships and meaningful friendships? And do their teachers like them and show them that they're valued in that environment? And are they accessing sometimes maybe some more artificial reinforcements that then can be faded to more natural reinforcement? And then the last piece is, are we asking them to do things they can do? And if we are asking them to do things that are more difficult, are we supporting them as we ask them to do more difficult things? So this flow chart is kind of important, and it's a framework that we work from. The next slide. We have a classroom management behavior series that is on the Idaho Training Clearinghouse right now too. It helps teachers understand those component characteristics in a classroom that will help them be successful. And what's cool about this particular series, you can sign up and subscribe to be notified when there's new resources that come out in relationship to this series. It's going to go all year long. Right, the first one was Foundational 4, then we're moving into functional thinking. The next one, we're going to be talking about effective strategies in classroom as far as instruction, and we haven't yet defined the last quarter, but it's focused on what teachers are doing in their classroom. We're even highlighting in a podcast to let teachers share those successes that they have around these principles. The next slide. I kind of jumped to this one already. These three teachers at this point were the ones that were focused in the most current podcast and give wonderful expressions of how they've set up their classrooms for success. Next slide. FBAs and BIPs. This is really important for all of us to understand what the component pieces are. Parents are a super important part. You guys are the experts on your kids, and teachers support you in that knowledge and being able to make right decisions. So being a part of that analysis around why the child is having difficult time in school or a difficult time in a task is really important. And then we really emphasize that FBA or that analysis around the behavior is connected to the interventions that we plan to support the child, not just the teachers around them, but the child in learning the skills that may be missing. Why are they acting poorly, and how can we help them find other ways to say, no, I'm not ready to do that right now, or no, this doesn't make sense to me. So we want to help our kids understand and learn so that they don't have to act in frustrated ways. Difficult Learners is all online. These are all archived topics that we have taught previously that you can access. Our teachers need to understand how motivation works in a child's life, not just that we're going to give M&Ms, because that's not really the point, right? We want them to get that motivation from doing interesting, engaging things and connect to that natural reinforcement. These are both linked to the supporting documents. We've talked about Restraint and Seclusion already, guides districts and buildings about making decisions that are within the guidelines and the information and the research we know about this. And the supporting and responding to behavior as links and video samples of some of the practices they have outlined for teachers to use in classrooms. PBIS has got some great resources now. The best way to access those is pbis.org. You can also go to the PBIS world, and it's got some kind of teacher-friendly and parent-friendly resources in categories. But these two are particularly effective strategies for setting some data around what's going on so you can make better decisions around the function of the behavior, and then supporting your students at home. Maybe there's some information that would benefit you. This website is one that we are finding some amazing resources in. It's the National Center for Pyramid Model Innovations. This particular section is under implementation. If you look at the top bar and click that bar and then go down to family engagement, you will find hundreds, I am not kidding, and ideas and resources about how to engage, how to use engagement to help your learner learn at home or in alternative educational settings that you might find yourself in this wonderful COVID environment. So please explore that. They're super fun, they're super friendly for any person who wants to access that information. And then the last thing, I just want to let you know that SESTA does have very qualified staff members. They're experts in being able to help you through the IEP processes that might support and protect your child. They're also there to help you do analysis and support the school in analysis around challenging behavior. So that we're not just working at the escalation level, but we're making some program decisions way sooner than that will support the learning of your child. So you can go to that click and say, I want help, and we'll connect you to a consultant that can help you with those decisions. And then I'm going to let you peruse the other resources on your own because I know we're out of time.
Well, I want to thank everybody here who participated with us. It has been amazing to get to have this conversation and to bring everyone to the table. I know we've had some questions that have come in, some of them about things like, what if they call it a quiet room? Is that really a seclusion room? Also, we felt it was imminent danger and that was enough, and that's an okay thing. I'm not sure that our panelists would necessarily agree with that definition, but what I would encourage you to do moving forward, if your child does have an IEP or a 504 plan in place and you would like to talk with your team about that, it's a great idea to schedule a meeting and to have a conversation about what they have in place before restraint or seclusion happens. If you still have concerns, Disability Rights Idaho would probably love to talk to you. And I know that there are other resources at the State Department of Education and also with SESTA that you could take a peek at. We will be posting all of these links and resources online so that you will have the opportunity at idahoparentnetwork.org to look through all of this and to click through on all the links. and you will be able to find ways to contact people to help out if you still have questions. So we are really excited and grateful that you had the chance to be with us today. And we want to say thank you to all of our panelists. This was a very important conversation, and I'm very grateful that everyone was willing to participate. So at that, I guess we're at time, and I look forward to hearing comments from you guys. Make sure that you take the survey and let us know, and we will pass those comments on as appropriate. So thanks so much. Have a wonderful day. Bye-bye.
Bye.